My biggest fear was having big cartoon teeth. I've been seeing a lot of people with the veneers. I did not want that look. I didn't want chiclet looking teeth in my mouth. You know what I mean? Like I wanted my smile to look as natural as possible.
Hi, it's Dr. Osafi with NewLife Dental Implant Center, and today we have two special guests with us. We're going to be hearing from some of our patients that have completed treatment at NewLife Dental Implant Center. We have our patients Shrad and Daniel here with us today. Thank you so much for coming.
Thank you.
Appreciate having you. Can you tell us a little bit about yourselves? Introduce yourself and tell us a little bit.
My name is Shrad Palmer from Pomona, California. Electrician. I actually just left work to get here right now.
Thank you. Appreciate it. Thank you so much. Daniel?
I'm retired.
Nice.
So I've been retired for a little while now. And background, before retired, I was in sales management, stuff like that. Before that, I did all kinds of things, from driving truck to Greyhound bus to
Amazing.
carpentry.
Amazing. Are you guys from California?
Yeah.
You are from California, born and raised? I know you're from Montana.
Here, I've been here like 40 years or more, but I was born and raised in Montana.
Montana. Nice. Amazing. Well, thank you so much for taking time out of your day to be here with us today to share some experience about, share a little bit about your experience going through getting dental implant treatment completed. I know many patients out there considering this treatment really want to have an idea of what it's like going through the process, and there isn't really a better way except asking patients that have gone through it to really give their opinion about it, you know. But tell us a little bit. So you started with us how long ago? About how long ago did you guys start treatment with us?
April 23rd.
April 23rd. So it's been about 2 months now, rough estimates.
Wow, you got the date down and everything.
Yeah. What about you?
Geez, I don't know what.
Maybe about
6 months ago. I'm not real sure.
Got it. And you do have your final set.
Yes.
Yep.
Yeah, I just have the lower.
Just
all.
the lower
I got
done.
my
Yep.
final set yesterday.
Got it. Congratulations. I'm really happy. And then you had surgery on April 23rd. And then you have your temporaries.
Temporaries, yeah.
Got it. Awesome. So tell us a little bit about where you guys started beforehand and what kind of led to the journey of even considering going after this.
Man, I had braces. Yeah. I had braces for a long time. I was not responsible, for lack of a better word. I had braces for over 16 years. And, yeah, I had took the wires off myself and just, like, kind of let them go back shift crooked. And I never did what I was supposed to do to the point where I had to get everything extracted. So...
Wow. How long would you say that process was before you even considered having them extracted?
I went through so many different dental places, like, to the point where, like, I kind of messed my credit up for them doing soft pulls on my credit. Like, you know what I mean? Like, I went through, like, 11, almost, like, yeah, I think about 11 different. And the prices were astronomical. It didn't set right with me. Like, nobody never made me feel like they cared. I was just like a patient to them. Like, and all they cared about was the money.
Exactly.
Like, when can I get the money? And you know what I mean? It was more so really trying to get me into a financial agreement to where I'm paying almost $3,000 a month. You know what I mean? And it was just like, nothing made sense until I got with NewLife, so.
Means a lot, man. Means a lot. Thank you. I'm really sorry that you struggled with that. I'm really sorry. Yeah. What about you, Dan?
I'm even sorry. listening to that story.
I know.
I'm no problems here after hearing that.
So I know you were wearing dentures on the bottom,
I
right?
had dentures on my bottom. Yeah, the teeth were just so bad. I just had a few left. I thought, well, pull those few that I've got left on the bottom and give me some dentures. You know, Medicare pays for them, so we'll do that. So they pulled the teeth out, and then they put the dentures in, and they just never fit. It was horrible. But yeah, the bottoms never ever fit, and it was just, I can't believe people wearing dentures. Not my parents; they both had dentures. My father just the lower, I think, but my mother had both upper and lower, and they always said, "Take care of your teeth. Take care of your teeth." Well, I never took care of my teeth, and then genes had something to do with it too.
Of course.
And they, one by one, they all rotted out, and I literally almost had I had, I don't know, maybe 28 root canals and caps on everything. When they started they just started to go one by one, and anyhow.
To wear dentures.
But then I went with the denture, and it never fit. So.
And I know that you had gotten a pair the day that you got the surgery done for extraction of your teeth, right?
Yeah. They put the temporaries in or whatever, and it just then the gums have to heal, and so then when they heal, they're naturally shaped differently, and then the denture doesn't fit anymore.
Yep.
And Medicare doesn't pay for only one set every 5 years. So being retired, I'm on Medicare. So then you're stuck with some ill-fitting dentures.
Common story that I've heard so much is the setup of insurance and how coverage for even dentures is difficult, even though it's not really the ideal treatment, because especially with the lower denture, it rocks a lot in the mouth. But knowing that really there isn't a better option than dentures through insurance is unfortunate, because
The price factor is a big factor for so much of America.
100%. Yep, it is a political problem, unfortunately, because there is only a certain amount of resources available for this specific need. And it's not recognized neither by providers or any agency, governmental agency, to really put a focus on.
By the government, like for Medicare, which is my case.
Yes.
But,
yes. And even insurances across the board, regardless of the population, insurances across the board don't have coverage for dental implants, where the maximum benefit for implants is about $1,500 a year, which wouldn't even cover the cost of a crown that goes on top of the implant, But so you guys kind of did your research. What was it like trying to learn about the process of even getting this done?
It was frustrating. It was frustrating because I kept coming into roadblocks. You know what I mean? It was like the prices didn't make sense. The obligations financially that they wanted didn't make sense. You know what I mean? And then it was like, I'm still young. I'm only 43, so wearing dentures was kind of like asinine to me. I didn't want to do that, you know what I mean? Because the first thing I'm thinking of is an older person that got to use the
old man like me.
You know what I mean? Not like that.
57-year-old.
Not like that, but you know what I mean? Because my grandmother had them, my grandpa had them, and they used to have to use poly grip, and I didn't want to do none of that. You know what I mean? So I was very, very apprehensive at first, and it's just crazy because you guys are I didn't even think that it was possible. You know what I mean? And even now, they're screwed in, so it's I can eat. You know what I mean? I can't eat the same things that I could before, but I still can. You know what I mean? I don't have to worry about popping nothing out, so it was a lot of my self-confidence, you know what I mean? And it was I didn't smile for 4 years because my teeth was so bad. You get me? So it was
That's a good point. I don't want to smile to the camera.
Yeah, and then, I immediately was put me to sleep. I don't want to be up I don't want to feel no pressure. I want to go to sleep and wake up with a new smile, and literally that's exactly what happened. You know what I mean? And man, I haven't looked back, and I'm excited because I'm still in the first processes of it, but the reactions I get from people, like I'm more conversative now. Like I can talk to people now. Before, and I'm an electrician. I do residential solar, so I'm with a different customer every day. So I'm very like apprehensive when I talk. It was just my confidence was real low
And
when
you're
I
a
laughed.
musician. You're a
Yeah,
musician.
and-
You rap.
Yeah, and that totally was out the door. Like I didn't want to get on camera. I didn't really want to record like that because I had so much pain. You know what I mean? I couldn't eat. I was eating with the back of my teeth.
Yeah,
Like, I ain't
right.
bit down on an apple in years. You know what I mean?
Yeah.
So,
The first thing I noticed when I met you, which was just today, how wonderful your teeth looked.
because that's the first
Like-
thing people see.
Yeah,
you know
like,
what I mean?
wow, look at those
Yeah,
teeth.
man. So,
Yeah, I agree. I agree. It does pop out. He's got
Yeah.
pretty nice teeth.
yeah,
Like,
and it make me look younger now because like before,
Yeah, that's
like, I
true,
don't know,
too.
it just,
Yeah.
I don't know, man. Bad teeth really dampens your appearance, your confidence, everything. You know what I mean? And like you said, it's the first thing you see. So,
Yeah, right, exactly.
100%. It just shape your perspective because you don't know until you have to deal with the dilemma, right? And all of a sudden it becomes the biggest problem in your life, and then you're kind of coping with it. And we see that honestly every day where patients come in, they are sort of burnt out. Either they've gone through years and years of just having to deal with issues with their teeth because of finances that have come in the way of them doing something. And then there's ones that have the finances, but I've never really found a process that would make it simplified to do everything in one go and to give them the security that it actually can get done to deliver on their promise.
and that's what my situation was. Like I had them because I'm an electrician. I got the money, but they didn't want that. They wanted me to get financed, and I'm like, I'm not paying a house note for my mouth
Yeah,
every
or
month, you know,
more,
on top
yeah.
of the mortgage that I'm paying. Like
yeah.
it's crazy. You know what I mean? It was, and you guys' name is the irony in having the name NewLife. Like it really. I know I got one. You know what I
should
mean?
Life,
Like
yeah.
Means a lot.
my whole approach now is different. Like, like I've been waking up smiling. You know what I mean? So
You don't
You
have to think
deserve
that
it.
when you go to have a meal or go to have a snack,
yeah,
you don't have to think, oh, let's see, what is it?
right.
How is it going
Right.
to affect
Yeah.
my chewing? Can I
sure.
chew this?
For sure.
100%.
You know,
When it came to decision-making process, what fears did you guys have, just overall, you know, considering going through the process before you started?
Well, this one was a little bit different because I was able to just pay everything up front. You know what I mean? And that kind of was a blessing too. You get me?
Yeah.
Like because a lot of people don't have the luxury of being
Ability to
able to
do that.
financially, take care of it right up front, you know what I mean? And the fact that I was able to do that and not have to make payments and get financed, like that was my biggest thing. Like, you know what I mean? Because like I told you, like when I went to like Western Dental, terrible. You know what I mean? And they was trying to get me to pay over $85,000. You know what I mean?
Wow.
And almost 3 different finance companies I would have had to pay monthly.
wow.
That added up to about $3,400 a month. That's crazy. You know what I mean? So,
Yeah, that is crazy.
yeah.
Sorry, what an experience. What about you, when it came to finding a place, making the process?
I actually experimented at the dentist that I had one tooth that was bad, so I said, let's do one implant here. And I needed some bone grafts for the implants. So they did bone grafts and they did one implant. So I was experimenting to find out how it would go to have an implant. And unfortunately, I didn't know at the time. I'm still not even sure what's going on with that dentist, but it's like the dentist had retired or somebody bought that dentist office and they were taking people out of dental school and interviewing them, and every time I went, I had a different dentist.
I'm so sorry.
That said, okay, I'll be your dentist, and then the last time I ever saw him was that time. I come back in 2 months or
dentist.
whatever, and there's a new dentist. Hello, I'm Mr. So-and-so. I'm Miss So-and-so, and I'll be your dentist now. Last time I ever saw that one.
Oh my God.
So
Sounds
I
like a
kept going.
nightmare.
So to put that one implant in, I don't know, I had 5 different dentists, I guess,
It's like a
from
dental
beginning
school.
to
It
end.
was like a dental school.
Yeah, a dinner school interview or something. But anyhow, and then I got the tooth, the one tooth there, and it seemed to be too big. They didn't even, it's a lot larger than the one on the other side.
Yeah.
Sorry about that.
So, it was just kind of crazy. But I figured, well, I got some, and sometimes they need bone grafts if you don't have enough bone up in there or wherever.
Of course.
So I got that done and got a little bit of experience with that. So then I started looking around, and I'd been looking around for 2 or 3 or 4 years went to a lot of different dentists.
Yeah.
They weren't as bad a run around as you got, but pretty much bad. Like, how much was that you said it's going to cost me, and blah, blah, blah. Anyhow, finally found you guys, and after all the other looking, after doing my due diligence and research and everything, I thought, okay, well, this is about right, and let's do it. And I just had a few more teeth on the top, is why I didn't do the top yet. I'm going to leave that until they start to go.
So that's the
But
key.
I've got my bottom, and they feel great. I just had them put in yesterday, by the way, my final teeth.
Congratulations. It's a big deal. Just brand new final teeth in the mouth. And it really highlights not doing one arch and doing the other one. A lot of patients believe that they have to do both at the same time. And I would say 90% of patients could get away with just doing one arch.
One arch like I
In
did.
rare cases, we have to do both upper and lower because of a bite discrepancy and whatnot. But for patients out there wondering if they have to completely have everything extracted, that's not true. We recommend that you preserve natural teeth if they're viable and they can function properly. You want to preserve them. If you've exhausted all options and there's really nothing else, or you're having failing dentition with chronic infection and pain, then absolutely there's the better option of getting dental implants.
So as far as cost goes, that should help a lot of people if they can just get the one arch done, like I did, and then and then once I get that paid off, I had a good enough credit score to get 0% financing, so I just went with that.
That's amazing. That's amazing.
And that helps too for those people that have a good enough credit score to get 0% financing.
Yep. A lot of patients don't even know that that option is possible to get 0% financing on dental implants. But of course, the different options that are there, and of course having a good credit score, it makes it possible. But there are definitely other options available for finances. Now, when it came to your experience getting this procedure done, from the moment that you got the procedure done to the time that you got your teeth, the day after, what was the experience? The temporary teeth, the day right after. What was the experience like? And you can dig in with the pain and everything. I want to bring it all out.
Yeah, well, I've been to the dentist so many times over the years that the pain wasn't really that bad for me. Pain's different for everybody, of course. No, the worst experience that I've had was you guys told me, well, okay, you've got the temporary, you got the teeth pulled, you got the gums have to heal, you got the temporary put over there while the gums and everything heals, while the bone grows around the implants, the titanium implants. So you can't be biting down on walnuts and cracking walnuts with your teeth and stuff like that, and you have to be gentle with you. Not even, I'm making going a little too far there, but I was supposed to eat mush, basically.
Yes.
But
During your temporary
that was the
phase.
hardest thing for me to do.
It is hard, and I'll be very frank. There is a limit, obviously, to where the teeth will break, but we've learned that there's a process that most patients follow. They're usually really good for the first 2 months, and then they slowly start pushing the limit.
Yeah, I can
a little
imagine.
bit. Usually
Yeah.
at 2-month mark, they're like, "Hey, this is not isn't broken so far." Mashed potatoes, avocado, and then the chips start coming in, and then the burger does it.
Yeah, and that's kind of where I was at with it. Like,
It was
'cause
hard for you too.
Yeah, because
that
I mean,
first couple months?
applesauce, pudding,
Yeah,
yogurt, protein shakes, and I work out, so protein shakes, I was already immune to that. But it was like the pain that I've endured with my teeth over the years. It was like when I did get the process done, I was so busy trying to take meds and try to stay sedated that I didn't even like really realize until like I would wake up the next morning and you can feel the pressure, but then I'll take my medicine and I'll be okay. But as far as like the eating part, I'm at my 2nd month mark, and I went to Applebee's the other day, and I got some tater tots.
Okay.
You know what I
Okay.
mean?
Oh, that's right.
But
You're-
then it
you're-
was like
you're 2 months right now.
Yeah, but the moment I ate them, I ran to the bathroom and tried to rinse them out. Like this process has taught me how to like take care of my teeth, especially now. Now I got that water pick thing, so that's my best friend. I take that with me everywhere. Like, you know what I mean?
Awesome,
I
awesome.
pull that out. They be like, man, what's that? That I need this, bro. You know what I mean?
That's
So
it.
After
What
lunch
was
at
your
Applebee's.
biggest fear before surgery?
my biggest fear was having big cartoon teeth. I've been seeing a lot of people with the veneers. I did not want that look. I didn't want chiclet looking teeth
Yeah,
in my mouth.
exactly.
You know what I mean? Like I
That's
wanted my
veneers
smile
for
to
you.
look as natural as possible. Like, and I must say, like you guys pulled a miracle off. Like real talk. Like because I was not expecting to like wake up and have teeth already. Because I had to wait a day and then come back the next day and get the screws in. You know what I mean? And that was a process I wasn't used to. I thought that I was gonna have to do the denture like my grandma, and that didn't sit good with me at all.
And I'm happy because the technology that we have now is what allows that to be possible, to do it in one day and to get it to close to as perfect as possible. It's because of the technology. I want to give credit to the people that have been involved because,
Even went on
and I
before
can
you,
admit
huh?
this, and I can admit this, that both of you guys have not gotten treatment by me specifically.
Yeah.
I actually hadn't even met you before today.
Right.
So you've been treated by other people in the company, and it's really important for me to hear this because I know they've done you well.
Yeah, and it's like all of you guys are like very like personable. You know what I mean? Y'all don't treat the patients like a pay number. You know what I
Yeah,
mean?
this
Like
is- this is
it's
true.
like you guys actually.
I
It
agree.
seemed like y'all
I agree with
actually
what
give
you're
a
saying.
damn. You know what I mean? And that's really what kind of won me over. You know what I mean? Because, like I said, man, after going through 11 different places, you get tired of hearing like, okay, so when can you get them? Like, dude,
Yeah, getting
what
treated
about
like sheep.
Like, yeah,
And
like I want to know what's, you know what I mean? Like, and then they would like the quality that they were trying to give wasn't the top notch quality, and trying to talk me into just getting the lower. Like, I'm young, man. I don't want to. That was the main thing. Like, you know, you don't realize how much of a confidence killer it is
yeah, I can
with your
imagine.
teeth, man. So,
Huge.
man.
But to get a team of people, and this is very true, and I would admit to this, to have a team of people working together that genuinely care is probably the most difficult thing in the working field, to try to find people that outside of trying to make money, they recognize and are considerate of how delicate the patients that we treat are, to actually put themselves in their shoes, because there is a disconnect. If someone is just trying to provide service like oil change to someone, or you pay me for a service, and there is no human connection, it's very hard because you're in someone's mouth, and we're dealing with everything. The entire mouth is our business. We're not doing a filling or fixing a crown. We're not moving teeth around like an orthodontist. We're taking everything out, changing the bite completely, changing the smile, changing where the joint hits when you close and open, where your teeth are when you're speaking. Everything is changed. So it's a very delicate process. It's a lot of information that you have to give patients. So it's so important that through that hiring process, we're not only evaluating skills, but really human connection for people to actually understand the pain of that others have endured, and to deliver work with that consideration in mind.
I was thinking maybe you just got lucky in the Torrance office with all the people, everybody I dealt with, from the front desk through, they were all really nice, caring people, and I'm not getting paid to say this. You know, it's they were all really decent, caring people. And I thought, well, you got lucky. You got a good personality here. So, but I guess there was some thought behind maybe who you hired.
Thank you. We're very lucky. We are lucky because the people that we have on our team genuinely care, and there is an internal responsibility to not let anyone down. So we as a collective, we do take on more challenging cases, and I can say that admittingly that there are cases that get turned down in 10 offices, and they come to us, and we say yes purely because of the story, because of the struggles. And we have a network of surgeons in our team that we work with that deal with more complex cases, and really going in the depth of dealing with all issues surrounding a patient, not just the dental issue, but really the patient's experience is how I believe we can provide the best care, because you really address patient concerns that are emotional and they have built up over the years. Patients also are very skeptical. This is another thing that I've noticed, because we're dealing with patients that have struggled so much. You being in orthodontic treatment for 16 years and then having a ton of work done over the years, I know that a lot of patients are traumatized. They don't want to let another
and I've
person.
had dentists that have cost me teeth. I have lost 4 or 5 teeth because of mistakes dentists have made.
Wow.
You know, and on top of my not taking care of my teeth like I should have.
But still,
a
yeah,
dentist shouldn't make you lose your teeth.
of course.
You know.
Yeah. Well, what about this concept and I always talk about this. So the regular process of going to the dentist to fix your teeth is you go to a general dentist. You find a general dentist that does cleanings and X-rays and like $49 exam, X-rays, everything. And you go there. Typically, they ask you if you have dental insurance, and they usually treat you based on the coverage that you have in dental insurance, right? So if cleaning is covered twice a year, you get that. If something else is not covered and you need it, they won't even mention it in many cases because they know that you don't have coverage for that treatment, right?
That's true too, yeah.
And obviously the insurance company limits it. I mean, I've mentioned this before, and I know I'm going to get heat for it again, for talking about the process of general dentistry and how it's patchwork.
Who's going to give you heat?
Dentists are going to give me heat.
Other dentists that want to.
They do here and there. They do here and
Yeah,
there. Give me some heat.
I got you. I can see that.
Yeah, I see openly, but it is a process that is routine in many dental offices, where the office manager comes in and opens up the insurance pre-qualification form. And I worked at a dental office that was like this, unfortunately, and they only offer treatment that has insurance pre-qualification on it. It's pre-authorized approval, and when I sit down in front of a patient, I'm supposed to tell them only what is covered, and not what is not. You know, and that's where there's a disconnect between actual care, listening to someone, their concerns, their actual needs, what they want, how they envision themselves, as opposed to following an insurance cookbook of what is covered, and that's all I'm going to offer because I need to go home and take care of myself, you know. And it's unfortunate, but it is a reality, and I've seen it, unfortunately, in multiple segments of not only dentistry, but medicine. So it's a big deal.
Exactly.
But thank you guys for sharing those experiences.
Absolutely.
I think
Absolutely.
it really helps with that. When it came to surgery day, can you tell me a little bit about surgery day? Maybe I'll ask you. I know you just recently had surgery.
I was sedated. I had got the IV and the anesthesia.
Okay.
So I didn't want to, because I'm squeamish when it comes to that stuff. You know what I mean? But it was like,
Many people are. You know.
What
I
about
kind
the
of I kind of snapped on your anesthesiologist because he kept missing my vein. I'm like, hey, dude, you got one more time to miss my vein, bro, and I'm getting up. You know what I mean? Because I hate needles. You know what I mean? But they got me together,
Thank
and
God you
before
didn't
I know
have
it,
me
I
doing
was
it.
asleep. You know what I mean? So it was, but I was still like in it, but not like they were talking to me, and I was able to answer, but then I was like out of it still. So it was like I was happy about that because I don't want to feel no pain, man. You know what I mean? But the stitches though, that was like the most irritating thing. because your tongue keep messing with them, you know what I mean? And you want them to dissolve, and it's taking forever, you know what I mean? So
That's true. I had the same experience. Why aren't they dissolving?
yeah, I'm like, man, I can't wait. Even when I went back, I'm like, can y'all cut the stitches a little bit? They're like, nah, we kind of need them to, you know what I mean? So the anticipation was heightened, you know what I mean? But
sorry about the stitches.
for the
there.
most part, yeah.
The stitches are gonna they dissolve.
Oh, they're gone now.
They're gone now,
Yeah.
but they dissolve away in about 60 days.
Okay.
60 to
So
70
that
makes
days.
sense.
quick
Yeah.
dissolving.
Right,
ones.
right.
Yeah, the
Okay.
reason is because we suture in layers, and we want to make sure that the deeper layers are completely covered,
Yeah.
sealed, until and then the superficial layer to be covered completely. And that's why we have multiple sutures placed. We have double layer suturing, so to make sure that it doesn't open up at all.
And then it, like after that, I had to go that one day with no teeth,
Yes.
with the gauges in there, and they were kind of crooked. And I'm like, how is that going to work with them not?
What are
it was
gauges now? I've only had my
the
bottom
metal
done, so-
screws that they set for the actual denture to get screwed in.
they're
and the
sitting down there with nothing
They
on top
weren't
of them.
like, I'm thinking they're supposed to be even, but they were kind of like.
Yeah, they
Kind of
don't.
like
They're not
angled.
straight up and down all the way.
Yeah, they're at
Yeah.
an angle, and I'm looking. I'm like, man, I don't know about this. This look crazy. You know what I mean? But
But now
when they
look at
explained
you.
to me why they have to be angled, I'm like, oh, okay. And again, like you guys have a way of explaining things to where it calms you down, because man, I'm like, dude, I don't know about this, bro. Like,
So you bring up a very good topic, actually, specifically when it comes to setting expectations. Why? Because when I started doing this initially, it was a lot of information that wasn't getting translated to the patients, because the process is a little bit different than it's normally done. I mean, the whole process is very new, but it's done differently with the digital workflow, and a lot of patients don't know what to expect. So explaining everything in layman's terms becomes actually a part of the process, a part of the procedure. So a big portion of our training revolves
That's an
around
important
how
part.
to explain the treatment to patients before they do the surgery, so the expectations are set before they get the surgery done.
And the nice thing is we can ask you guys, at least in my experience, I can ask you a question and I'll get the answer without without having the attitude like, oh, really? You're asking, which I've got that attitude from other people before. Oh, well, really? Why? But just trust me.
But-
No,
but-
I want to know the answer. And
Because patients need that
Yeah,
information
they
to be able
actually
to
do.
make the best decision. They need to be educated, and realistically, spending a good amount of time with the patient, going into detail, that pre-surgery visit for 2 hours. But even with that, there are times I swear that I wish I could go home with the patient, spend a weekend
yeah,
drinking
right.
coffee in the morning and going into details about what they're actually going to be getting into, because
Yeah,
it's
right.
a whole process
yeah.
getting the surgery done. And then so you had your surgery done, and then so you were sleeping kind of in and out of sleep. And talking about sedation, we don't put patients under general anesthesia. We have them in this kind of a twilight
And that's
deep
what it
sleep.
was,
Yep,
right.
deep sleep,
And
because we
then-
don't want to take a chance. We
Yeah.
want you to breathe on your own.
Yeah.
And then you woke up, and then what do you remember then?
It's crazy because I remember everybody was around me. Like, you know what I mean? Like, you guys was like real hands-on. My anesthesiologist, he was still right there. Even after I had cussed him out, he was like, I'm still here, bro. I'm like, good looking, because I wasn't liking
that
you at
vein,
first.
I'm
But
gonna
that,
get
he
you.
became my buddy at the end of the day. You know what I mean? But yeah, what I really remember the most was like going home and just like, I still kind of like couldn't feel nothing. I would even try to like, you know what I mean? And I had to my mom was like, nah, don't do that. You're going to hurt yourself, because I couldn't feel nothing. Like, but the next day, I felt it for sure.
You felt for
Yeah,
sure.
for sure.
And then you came in, you got your teeth the next day.
Yeah.
What was it
and
like getting the teeth?
It felt good. Like, man, I posted it on Instagram, and everybody was like, "Look at the boy!" Like, yeah, like I got $1 million smile now. Like,
And,
for
and
real.
you do. I mean, I'm not just saying this. I met him for the first time today, and I look at him, and the first thing that showed, man, look at that smile. Look at
Yeah,
those
you
teeth.
should have seen it
and
before.
and I thought those was the permanent teeth, and those are just your temporaries.
Yeah.
And the permanent are going to be, they're better.
And that's what they were telling me. They're like, "Man, wait till you see the permanent." So I'm super
yeah,
excited. Like,
anyhow,
yeah,
I'm excited to hear your story.
I mean, I'm honestly saying that,
yeah, man.
you know.
I appreciate it, man. Thank you, man. 'Cause
you guys deserve it. You really deserve it. It's refreshing for me, and obviously it's a big compliment to hear that you guys have gone through the process and you're doing good, and that it's done you good. It means the world, actually. And the biggest part of it is that confidence boost that comes with it. Obviously, knowing that
Right.
that there is an option, that you don't have to deal with something coming out of your mouth when you're talking, and being a little bit younger, of course, the expectation is not there even. But how would you explain to someone who is on the fence, who has never really even thought that it's possible? How would you explain to them the process is like?
It's kind of like hard to like just give it in a nutshell, because like I said, like it's kind of like a miracle that what you guys did for me. You know what I mean? What I was expecting and what I dealt with was just like polar opposite. You know what I mean? Like I thought that I was gonna have like to deal with so many different things, like having to hold my mouth closed and fear of stuff falling out, you know what I mean?
Yeah.
My bite, talking, you know what I mean? The first couple of days was kind of hard, but now I'm back regular, you know what I mean? And now my biggest concern is will I be able to bite all the way down? That's really it, you know what I mean? But as far as explaining to somebody else,
But you will be.
Yes.
Yeah,
Really.
You
I got
will
my
be able to
permanent
bite down.
today,
Yeah.
and
Yes.
even though I only have the bottom, you can bite down hard, and man, someday I'm gonna get my uppers too done.
Yeah.
And I can't wait. I mean, it's great. You're gonna be able to bite. He's gonna be able to bite an apple, right?
Everything.
but in retrospect to what
Eat a
you're saying
steak
as
and-
far as explaining,
Yeah, it's hard to explain.
because
It's
everybody's
just
got a
that-
different situation.
That's true.
Yeah, and everybody feels differently about it. With me, it wasn't that big of a deal. With you, you had a lot of fears and a lot of trepidations, whatever the word is, and you know, it's
The main thing I would tell them is to take care of your teeth, the ones you do got. You know what I mean? Take care of them as best as you can. But if it's one of those where they're on the fence and they got a, I don't even think that nobody got a situation like mine, because I was just so irresponsible. You know what I mean?
there's a
Living the
lot of
street life.
irresponsible people out there, though. I
Live-
was,
you know
I
what I
was
mean?
to a
Of
degree
course.
myself.
Just not caring, just thinking the problem will fix itself. Like I had this
Yeah.
naive outlook on life. Like it was just like crazy. You know what I mean?
100%.
And I don't think that nobody would ever let their teeth get as bad as I did.
You'd be surprised, and I want to say that.
And they
really
say
openly.
that.
Yeah, you'd be surprised because you don't know the stories that are out there, the type of patients. And patients, everyone has stories. You know, we see patients that have a past of extreme drug abuse. There are patients that have had eating disorders that have destroyed their teeth at a very young
that too.
age. Patients that have a genetic discrepancy of weak enamel. Many patients suffer from this. Some that don't have the genetic makeup of it to even make good enamel. And they have weak teeth and they break down really quickly at a younger age. And unfortunately, everyone judges themselves the same way that you have, because you're completely blaming yourself, of course, for the situation. And
absolutely.
in many cases, there is responsibility that you can take
sure.
as an individual, but it's not balanced. Not everyone is the same. There is such a thing as weaker teeth with less mineral, more porous, that get cavities easier. And our goal is really to get the knowledge out that people know that their specific situation, as severe as it may be, there is a solution and it's available and it's possible to allow them to have a fully functioning set of teeth. Some patients, they sort of exclude implants because they think they're just not a candidate for implants, either because they had cavities, maybe they also will have cavities with implants, or something will fail because their teeth were bad.
Yeah.
Maybe the bone is bad. But that's not the case. Implants have transformed so much since their inception, since they started becoming popular, that the technology allows implants to survive in patients that have severe uncontrolled diabetes, patients that had a history of smoking, and
that was me. I smoke.
Yeah.
But I don't smoke cigarettes.
exactly.
You know what
But
I mean?
yeah, but still having a past
Yeah.
that they believe is going to prevent them from getting a smile and having a beautiful smile, and they don't really think there's even an option. Like for yourself, you believe your case was the worst case, right?
Yeah.
And the truth is, so imagine you have a patient, Yvette, who is a cancer survivor. She gone through cancer treatment. Cancer treatments, they destroy teeth like nothing else. They rot teeth
Suck
in
the
less than
vitamins out of
3
your
to
body.
5 months. They destroy everything. She had a beautiful smile. She lost everything in less than 6 months. Had everything extracted, went to dentures. The problem is that it affected her psyche. So she started on antidepressant medication purely because she was going in the dark path, and as a result of not having her teeth. She beat cancer, but a new problem started, and until we were able to get her treatment done, her treatment was a little bit more complex, but it was definitely no different than getting it done on a healthy patient, because there are protocols that
That's quite
can
a
be
story.
followed that give us the ability to strengthen the bridge with more implants and giving the patient the exact treatment that they envision themselves having, the exact set of teeth. And we can replicate teeth from a long time ago. I know your teeth look beautiful, yours do as well, but you can choose a set from a movie that you've seen, and our lab can deliver that. But obviously, I recommend most patients go with the most natural look, something that's a little bit more age appropriate. And that's why we show the smile design. What are your thoughts about the smile designs that we showed you? I know you only got your bottom done.
Yeah,
but
I only got the bottom, so I didn't really get
Yeah,
into that
yep.
because my top are what show when
Exactly,
I smile.
exactly,
My
exactly.
bottom's
What about
hidden
you?
by the lip, but
The color choice was most important, and the cut of the teeth. I didn't want all flat across, you know what I mean? Because I've seen people that have all the same size teeth. They're all cut the same, and it looks weird, you know what I mean? Like, I didn't want that. Then it was like, in retrospect to like the expectation, I didn't want my gums to reject the implants, you know what I mean? That was like my biggest fear, like, man, please don't. And I didn't even know what happens when they do reject. Do they push them out, or, you know what I mean? So
100%.
it was like so many things, you know what I mean?
100%.
But yeah, I like the fact that you guys have like this scale where you can pick. Because you don't want them too white,
No, you
you
don't
know what
want-
I'm
yeah.
saying? You don't. So, man,
You're actually the
Yeah.
exception, though. Most patients do want them white.
yeah, right.
Yeah, most patients want to go as white as possible.
to
yeah,
back
but
me
then
off
when
a
you
little
do them
bit.
too white, it look fake. You know what I
Absolutely.
mean? You
And
kind of want them
100%.
natural, but you know what I mean?
Yep, yep. But we let patients do whatever they want.
what they want
They
to
want to
do.
express themselves
Yeah.
with super bright teeth.
Yeah.
And that's really the key is, having the ability to choose what you want, and the lab will deliver it. But the one thing, too, is when it comes to setting expectations, I must say, this is what I have struggled with a little bit. Because everyone has their own mindset of how this process should be completed, they, in their mind, have standardized it, that it should happen the same for everyone, the same exact way.
Yeah, right.
For example, people come in and we tell them, hey, the treatment can take 3 months. It could be 4 months. Sometimes it's maybe 5 months or 6 months if we have to try out another set. And it's good to know that it could take a little bit longer.
But people are used to seeing that billboard on the 5 freeway that says get your teeth in one day
That's it.
for a totally low price. I think it's even still up. It's been there for years.
Really, wow.
Yeah, and it's crazy, and they don't realize it takes a little more than that. But again, you do get your teeth.
Yeah.
But your gums and everything has to heal. The bone has to go around the titanium inserts, the implants. And you can't, that has to happen. Then you get your permanent teeth. And really, it's as simple as that.
Absolutely. And we are there with you the entire 3 months of healing, because people also don't realize that during that 3-month period that you have to heal, there are things that you need to know. You can't just deliver teeth and be done with it.
For sure.
And we have to be with you through that process. That's why I still don't get how they could deliver a final set in one day and be done with it.
Yeah.
That's why when I see the marketing for that, I'm a little bit surprised. And I do believe that there is a place that you have to give. The human body has to heal. We can speed up all the technology, but we cannot speed up healing.
And dude, it's like a blessing in disguise, because I didn't even find you guys. I was looking through so many different dental places. You guys popped up on my phone, and I just gave it a shot. You know what I mean? Because I was to the point where I just was about to give up. Yeah, no, for real, because I didn't find you guys by searching, and then found you literally, it popped up on my phone, and I'm like, let me give them a call. You know what I mean? Yeah, man. So this is all. I'm still at awe. You know what I mean? Because I didn't think that it was possible. Really, I did not think that it was possible. Everywhere that I went, I was trying to pay the lump sum. They would not do it. They was like, nah, we have a finance company. We dude, I make money. What are you talking about? You know what I mean? So, this entire thing from start to finish and I'm still in the starting process, but man.
Well, thank you.
For the people that are listening to this or will listen to this in the future, we're not getting paid to be here. I found you guys were friendly enough and good enough human beings. And again, I'm not just bragging on you. I'm saying I'm just here on my own. Of course, I'm retired, and so it's no big deal for me. But I thought I would probably be bored at this point, and I'm not. It's interesting. It's interesting to hear your side of the story. New stories and things, things I haven't thought of before, but we're not getting paid to be here. We're here out of gratitude and, I guess, friendship in a way.
Yeah. I left work early just to get here. Yeah. I still got here late. You know what I mean?
Yeah, but you
guys are
you left
amazing.
work. I didn't.
Sure.
So that's
I'll be very sincere. Listening to your story, both of you, listening to the stories, it inspires me. And it gives me double, triple the energy to keep pushing hard because of how genuine you are. And to hear that the change that it's made in your life, it really does change my perspective in how much harder we need to work to spread the message about the possibilities out there of what is actually possible with dental implants and using the digital workflow to be able to deliver work and doing it affordably, to be able to provide care where it actually ends up being in the hands and in the lives of patients, and it affects patients' lives. I thank both of you for taking this time to come here to sit with me, even though I wasn't the one doing your treatment. I haven't been involved in your treatment, and I'm grateful, for you to drive out to give that insight. And I really mean it. It's been a true pleasure treating you, and I know your treatment is going to be completed well, and I can't wait to see you bite as hard as you can into a big piece of steak. I can't wait to get a steak, tomahawk, man. You feel me? A burger. Absolutely. For sure. Will we be able to eat chips? Everything. As a matter of fact, we may go back there right now, and we're going to eat chips together. We should do it right away, I swear. Thank you both for being here. And for sure. Thanks for tuning in and listening to our episode 3 with our wonderful patients sharing their experiences and their stories with us. We're really grateful that they took the time to come out, share their stories, and if you're interested, listen in more as we bring more industry members to share their stories. Thank you, and thank you guys for being here with us
Thank you
today.
for having us.
Absolutely. Pleasure.
Absolutely.